Hi, welcome and good afternoon. This is Elizabeth Hardig with the American Planning Association. We are excited to have you attend our webinar this afternoon about local food action plans. It is an action-packed session and we only have 30 minutes, so we are going to dive right in. If you have questions throughout the webinar, please don't hesitate to chat them in the chat box that should be on the right-hand side of your screen. We are planning to save the last few minutes for discussion. And with that, I will officially get things started. Our first speaker this afternoon is Kayleen Koch. Kayleen is the Principal Planner for the City of Newark's Department of Water and Sewer, and a co-chair for the Healthy Communities Collaborative, an interest group of the American Planning Association. Kayleen is currently leading communications and public engagement activities for the City of Newark's Department of Water and Sewer, and in a prior role, Kayleen was the project manager for the Plan for Health initiative in Trenton, New Jersey. We've invited Kayleen here this afternoon to share a little bit about the Healthy Communities Collaborative before we dive into our community example. So with that, Kayleen, I'm going to pass control over to you, and you take it away.
Great. Thank you, Elizabeth. So, hello, everyone. I am Kayleen Koch. I'm so excited to share information about the Healthy Communities Collaborative, which is an interest group of the American Planning Association. The Plan for Health project that I worked on really connected me more to APA's Planning Community Health Center and led to my involvement in this collaborative. So I've been working with the other co-chair, Grace Kwong, and APA staff from the Planning Community Health Center to further develop and organize the interest group. I'm going to read you our mission statement so that you all know the purpose of the collaborative and where we see the group going. As an interest group, so the Healthy Communities Collaborative is an American Planning Association interest group of planners and allied professionals who are interested in fostering cross-sector collaboration and increasing capacity to support building healthy communities through the local, regional, state, or national level. Now, as an interest group, you do not have to be an APA member to participate, and we encourage outside professions to join our collaborative so we can meet our goal of fostering cross-sectoral collaboration. I joined the collaborative because I was interested in further building upon the Healthy Communities movement that was catalyzed by my education and Plan for Health, along with other supporting factors. Because I was interested in connecting other folks across the nation that are working on the promotion of healthy communities, because I was interested in sharing and learning about projects, partnerships, and ideas for supporting healthy communities to leverage in the work that we are all doing in our jobs at our own communities. The collaborative has regularly scheduled quarterly calls to share and learn with group members. We have 3 working groups, including policy, education, and then the partnerships and outreach working groups. Each working group connects bi-monthly, and they are working to develop action items for promoting healthy communities. We are fortunate to have reps from American Planning Association's Planning and Community Health Center involved in our structure, and a rep for each working group. So far, each working group has had the opportunity to begin identifying potential initiatives and projects that they want to undertake. So I'm going to give you a little example of what they envision for the working groups, but this isn't all of them. Some of the ideas the policy working group talked about included creating a resource to help planners understand where they can influence health in their work, identifying what zoning codes are doing to further the goals of healthy communities, promoting health in all policies to planners that are not already involved in the healthy communities movement, and providing review and critique of APA's health policy guide, which is currently under development. Some of the ideas that the education working group talked about included identifying programs at higher institutions that are connecting public health and the built environment beyond planning programs, also looking at engineering programs, identifying opportunities for the medical field to contribute to the promotion and creation of healthy communities, creating educational opportunities to help expand the movement and advocates, and identifying ideas for making the intersection of health and planning attractive to funders. Some of the ideas that the partnerships and outreach working group talked about included creating new advocates to help advance the promotion of healthy communities, especially in cases where you can't be the advocate because of your role, sharing best practices and the vision for working together as a way to get folks motivated in their own communities, getting to know new people and organizations, what they are doing, and looking for partnership opportunities. And finally, identifying and maximizing our current assets. As a part of our membership quarterly calls, we have created a platform for members to share what they are doing, the challenges and opportunities, and where they need assistance. We really believe this is an opportunity for collaborative members to work together and share ideas, and for the American Planning Association Planning and Community Health Center to respond to professional needs with future webinars and other tools. So there are several opportunities to get involved coming up soon. You can join our next quarterly call, which will take place on Tuesday, May 16th. You can participate in one of our working groups next calls, which are taking place over several time slots on Monday, April 24th and Tuesday, April 25th. At the end of this presentation, I have my email, and if you want to get involved, you can email me, and I will send you all the information you need and add you to our listserv. We also have several opportunities to connect at APA's National Planning Conference in New York City in May. At the National Planning Conference, we'll have a walking tour, we'll do a pavilion presentation, we'll have an informal opportunity to connect over coffee, we'll have a business meeting, which will be key because our working groups will begin to prioritize our action for the next year. And we'll have a joint reception with the food interest group on the Monday evening of the conference. Finally, the Healthy Communities, the team from APA's Planning Community Health Center is working to put together a Healthy Communities conference guide that will have all this information and conference sessions of interest. And if you're on our listserv, I'll make sure I get this to you before the conference. So with that, we're coming to a close of the presentation for me. And for more information and to get involved, just give me an email and I'll add you to our listserv. Thank you so much, and I hope to hear from you soon.
Great, thank you, Kayleen. So certainly the Healthy Communities Collaborative is a wonderful way to continue to connect with peer professionals around planning and public health and to attend more sessions that are like this, where we talk about the intersection of the built environment and our health. So a perfect setup for our two presenters this afternoon, Cheryl and Matt, who are from Columbus, Ohio, which also happens to be a site of one of our Plan for Health awards. So Cheryl and Matt will be talking about their local food action plan today and have a lot of great experiences to share. Before I hand things over to you, Cheryl, let me quickly introduce you. So Cheryl is a registered dietitian who joined Columbus Public Health in 2009 after 15 years of designing, implementing, and evaluating adult weight management interventions. From 2009 to 2015, Cheryl served as the co-chair of the Growing Healthy Kids Columbus Coalition. During that time, she co-authored the City of Columbus Early Childhood Obesity Prevention Plan and led the Columbus Public Health 2011 Achieve Community Team in efforts to utilize a policy, systems, and environmental approach to make the healthy choice the easy choice. Cheryl assumed the role of Healthy Food Access Program Manager in March 2015, and co-authored the Columbus and Franklin County Local Food Action Plan, which she'll be talking more about today. And with Cheryl, we have Matt Brown, a planning administrator and from the Franklin County Economic Development and Planning Department. So Matt is a city and regional planner with over 10 years of experience working with communities and stakeholder groups. He is passionate about helping communities preserve their natural areas and agricultural land, maintain community character, and provide transportation options for everyone. Matt has served as Franklin County's planning administrator for the past 3 years. As planning administrator, he oversees the work of the planning and zoning staff of the Economic Development and Planning Department. Matt has also managed and led multiple community planning and regulatory updates, including, of course, the Columbus and Franklin County Local Food Action Plan. So we are very excited to have you both here this afternoon to talk more about your work. And with that, I'm going to pass the slides over to you, Cheryl.
Thank you. I'm going to have Matt get us started here. There we go.
Okay, Elizabeth, thank you so much for that introduction, and Kayleen, thank you for introducing and describing the Health Communities Collaborative. That sounds like a really great effort here. So in today's presentation, we will talk about why we developed the Columbus and Franklin County Local Food Action Plan, talk about what the plan will do, go through the planning process that we use to create the plan, and then talk about our efforts for implementation. So starting out, as far as why this Local Food Action Plan project was initiated, both Columbus City Council and the Franklin County Board of Commissioners had a long history of and strong support of local food system initiatives, including providing funding for community garden grants, food business incubation programs, food access programs, and also working on regulatory updates that helped residents take part in growing their own food. And even though there was this long history of support for local food system efforts, there was no plan strategically addressing the needs of the local food system in our community. And this hindered our efforts to effectively utilize available resources and to realize the full potential of efforts to increase access to healthy food, affordable food, and local food. So in addition to why the city and the county initiated this project, there are some other reasons for doing this. The local food system affects our environment, public health, land use, the economy, and the quality of life of residents here in Columbus and Franklin County. A stronger local food system can create jobs and return vacant and underutilized spaces into community assets, and strengthening the local food system will have a positive impact on community health, the economy, and the environment. And just to provide some context into where the city and the county currently are, 20% of children in Columbus either experience limited access to adequate food or face uncertainty of having adequate food. This food insecurity leads to a higher likelihood of developing chronic diseases later in life. And during the 2014-2015 school year, 30% of pre-K and 28% of kindergarten students in Columbus City schools were either overweight or obese, which put them at increased risk of high blood pressure, type 2 diabetes, and other weight-related issues. And although most of us do not have to worry about having adequate food, we still do not have healthy eating habits. Less than 25% of adults in Franklin County report consuming fruit and vegetables be recommended 5 or more times a day. Now looking at the physical accessibility to food within the community, in 2011, 24% of Franklin County residents had to travel 2.5 times further to reach a full-service grocery store than they did to reach a fast food restaurant. And every day we are faced with the temptation to resort to eating fast food. And although I do really enjoy fast food, it should not be the default option for filling our residents' stomachs. And in many areas of the community, fast food is the only option available to them. And in these communities, these are frequently the areas of our community that have limited access to vehicles and public transportation options. Looking at waste within our community, about 13% of the material entering the Franklin County landfill each year is food waste. There's about 4,000 tons of material sent to the landfill in Franklin County every day. 13% of this equates to 520 tons, or over 1 million pounds of food waste every day being disposed of at the landfill.
So as we looked at the challenges and concerns that Matt described, we knew that we needed the plan to help us begin moving in the right direction. And as we developed the plan, throughout the process, our end result and what this plan would do became clearer and clearer to us. We launched this project in November of 2014 with the support and oversight of a city council member, Priscilla Tyson, and a county commissioner, John O'Grady. And they really launched this effort and directed city and county resources to this effort, rooted in the belief that all residents of Columbus and Franklin County should have access to nutritious and affordable food. And as such, the plan really seeks to address the consequences, really, of significant social issues that lead to inequalities to access and food. So while the plan is addressing the food system, the underlying issues that drive inequalities in food access, of course, are poverty, underemployment, and unemployment. So as we presented the plan to the public, we recognize that the plan is intended to inform public policy. It's intended to inspire program development, foster community collaborations, guide local funding strategies, and provide a foundation for grant applications. And actually, before we even finished the plan, and certainly before we've gotten very far into the process of implementation, we've already seen the plan begin to drive these types of processes. For example, as a result of an early finding in the planning process that some of our zoning codes, some of our public policies did not necessarily support or help our local producers, a joint plan was undertaken by our Department of Development at the City of Columbus called the Green Business here soon as well. It was intended, inspiring program development. We've already, and fostering community collaborations has already come to fruition with our Columbus City Schools. The Columbus City Schools really was not interested in talking about farm-to-school activities or engaging in those, but the local food service director for the Columbus City Local Schools participated in the working process of our food action plan. As a result of that work, as well as the collaborations that we developed through that process, they have launched Ohio Days starting in January, and now Columbus City Schools serves one menu a month that's sourced entirely from foods that are grown, raised, and or processed in the state of Ohio. That led to additional support for helping to expand that to our other local districts, which will be launching into those efforts here very soon. And there have already been a number of grant applications that have started to address the actual actions in this plan. So we've been very fortunate to have that happen. As I mentioned, it was launched in November 2014 and designed to address improving access to healthy food, affordable food, and local food in areas with limited access, creating linkages between consumers and producers as a long-term economic development and public health strategy, ensuring that locally and sustainably grown food is prioritized and made available to all residents, and preventing food-related waste. And so as we launched that, then we moved into the planning process, which Matt will tell you more about here.
And with the planning process, for all those planners that are listening, this process is going to look very familiar to you. This is a very kind of standard process for completing either land use plans or physical activity plans or any type of plan, really. And so with this project, we had 3 phases. And in that first phase, it was the current conditions and visioning phase, where we gathered information about the current conditions of our food system here locally and agreeing on a vision for how that food system should look in the future. And then phase 2 included developing program and policy recommendations that will help to achieve the vision. And the third phase is writing the plan, putting together the information from the current conditions and visioning phase with the policy and program recommendations, and identifying some priorities for implementation, who will be responsible for implementation, and what resources are available or are needed for implementation. And so digging into these phases, the first phase, again, the current conditions and visioning phase, this phase was designed to gain an understanding of the current assets and needs in the community and to understand the community's vision for the food system. And through this process, more than 24 food planning documents were reviewed. There were stakeholder interviews completed with representatives from all sectors of the food system. 4 surveys were made available online for various people, stakeholders within the food systems, whether they be consumers, producers, processors, distributors, commercial buyers. And then there were also 7 neighborhood food planning efforts conducted by Local Matters at the request of the City of Columbus. And Local Matters facilitated a total of 18 meetings in these 7 Columbus neighborhoods to identify and explore the neighborhood-specific goals that those neighborhoods had for improving access to healthy food and nutrition education. Those meetings occurred in the neighborhoods of Clintonville, Linden, Near East Side, Near South Side, Northland, Wyland Park, and the west side of Columbus, which includes Franklinton and Hilltop. As a result of those neighborhood food planning efforts, Local Matters developed food planning reports for each neighborhood, and those planning reports are available on Columbus's website. And those reports were relied on in the development of the Local Food Action Plan to look at the overarching actions that might be appropriate here in the whole community. The project team also reviewed published data that included the U.S. Census Bureau's data, USDA agricultural census data, and U.S. Bureau of Labor Statistics data to identify and describe the social and economic conditions of our food system. Through the current conditions phase, more than 900 people provided input, whether that was through the neighborhood food planning activities, the 4 online surveys, or the stakeholder interviews. And through this process also, the working committee agreed on a vision for the food system that would drive our efforts through phases 2 and 3. And that vision was a fair and sustainable food system that benefits our economy, our environment, and all people. In phase 2, the program and policy recommendations phase, this was designed to identify the actions that can be taken in the community that have the greatest potential to have a positive impact on food-related issues facing our community. These actions will help us move from our current conditions where we are today to our vision, where we want to go. The project team conducted a comprehensive review of local, regional, state, and national best practices by reviewing other local food action plans from around the nation, and also by reviewing planning and health publications. Our review identified over 800 potential actions, which the project team consolidated into 146 actions by removing duplicative and non-specific actions. And we presented all 146 potential actions to the working committee, who identified 44 promising actions to be researched for their possible inclusion in the draft plan. Once those 44 actions were identified by the working committee, the project team conducted additional research identifying model practices in our region and in other communities, and solicited stakeholder feedback to describe how these actions could be successfully implemented in Columbus and Franklin County. And with that, we developed a draft program policy recommendations document. That draft policy and programs recommendations document was presented to the working committee for further input, and it was also made available for public feedback. This feedback process led to the identification of the final 27 actions that were ultimately included in the Local Food Action Plan. And the final phase of the project of writing the plan We use stakeholder, working committee, and community feedback obtained throughout the planning process as a guide to develop a draft local food action plan. With the draft local food action plan, we provided a getting started table for each of the actions within the draft plan. The getting started tables included a current status of whether or not the action was new work within the community or something that had already been started. Identified who within the community, the organizations and the partners that would need to be engaged in the implementation of the action. It described objectives for the action and starting steps that could help those that may be engaged in implementation to help them get started in their work. The Getting Started table also included potential measures of measuring and describing success of implementation, and the tables included an identification of the resources that may be needed for implementation. Now, the Local Food Action Plan is a living document, and new opportunities and changing conditions will require that we consider new and innovative ideas that support the plan's vision. And prior to implementing any of the actions within the Local Food Action Plan, the feasibility or the cost and benefit of each of the actions must be considered comprehensively. The draft Local Food Action Plan was presented to our working committee and revised to reflect their feedback. And that revised document was then shared with legislative sponsors for feedback before the project team conducted an extensive 6-week public comment period that was led jointly by Columbus Public Health and Local Matters. And I'll let Cheryl talk about that public comment process.
Sure, thank you. And Matt has mentioned a couple of times the working committee, and the working committee was a 24-member group with representatives from a variety of all of the sectors in the local food system. And they were extremely instrumental in the actual doing of the work of drafting this plan and really trying to make sense of the public comments and all of those local food system and neighborhood food conversations that we had. But once they helped us create this draft plan, then we really wanted to go back to the community and really address whether or not we captured what our community wanted to hear or wanted us to focus on. So the public comment process was open from August 3rd of 2016 through September 30th for 2016, so just about 2 months. And from that perspective, we had an online survey available again, and we participated in 11 public feedback sessions. Our primary sources for these feedback sessions, Columbus Public Health hosts health advisory committees in a number of our communities around the city. We made ourselves available at invited meetings. We also participated in the Greater Columbus Growing Coalition, which is a coalition of our local community gardeners. Our local food council was extremely instrumental in working through the plan and providing feedback. And then professional organizations like the American Dietetic Association and other community organizations hosted our public feedback sessions as well. Overall, the feedback we received indicated that the plan reflected the community's needs and makes space for the food system work that needs to occur in our community. There were several common themes, though, that we identified in this process. And one of them was that we need to have an extensive focus on health equity and cultural competency, specifically addressing it in the plan and making sure that it's specifically considered and addressed throughout the implementation. It became extremely clear that our emergency food system has a very strong advocate in our local food bank, and that our work needs to be an integral part and be very connected to that work, but needs to not be duplicative. Residents and stakeholders wanted a clearly defined system for engaging in food system efforts. And then we also captured a tremendous amount of neighborhood-based feedback that will be highly relevant when we face implementation. So from the planning process, we further defined our goals, and that if met, we'll achieve our common vision for the food system. And each of these goals then is supported by the actions in the plan. And these goals are, of course, to enhance coordination and communication among existing food resources and agencies, improve access to and education about healthy food, affordable food, and local foods, increasing the role of food in economic development, and preventing food-related waste. So the plan was adopted in November of 2016, And as a result, we're now moving into the phase of the implementation process. But we really gave that a tremendous amount of thought and planning in the, while we were in the process of creating the plan. So one of the most important parts of any planning effort, and a part that's often given too little consideration, is the implementation after the plan is complete. We believe that the Columbus and Franklin County Local Food Action Plan has a strong chance of being implemented because of the framework that's recommended for coordination and communication. The plan recommends forming a joint city and county local food team, which is going to consist of city and county staff, and it's being formed currently. And it will collaborate with an appointed advisory group to implement the local food action plan and connect to other local food system efforts. The advisory group is currently being formed as well, and this consists of a group of high-level community organizers who can provide access to financial, social, political capital and help us move projects forward. This partnership will be responsible for leveraging public and private resources, reporting to the community, coordinating funding efforts, and building synergy between the local food efforts and emergency feeding, all to prevent redundancy and expand the reach of local food system efforts. This team will also establish clear and defined pathways for resident participation and ensure the implementation of the local food action plan remains connected to the community. And to do that, we are partnering with our local food council that has been in existence since 2011 as a purely volunteer organization. And we're using this opportunity to help use the city and county resources to provide some capacity for them, but also then to build that stronger community connection through our local food council. And those are efforts that are underway currently. And as I mentioned, we've had some great early wins, but that's the planning process as it stands. So I'm going to turn it back to you, Elizabeth, and see if we have any questions. I realize we're right at the 3:30 mark, but Matt and I are happy to stay.
Wonderful. Well, thank you so much, Cheryl and Matt. That was a fabulous presentation, and we did have quite a few questions roll in, and you've responded to some of them as we worked through the slides. Cheryl is right. We are at the 3:30 mark, so I know folks signed up for 30 minutes. You're welcome to sign off, and if you need to, but we will stay on the line and answer a couple of comments and questions that came in. I did just want to make sure that I have my responses correctly here. So the overall plan, we had a couple of questions about the overall timeline, and it sounds like it was just about 2 years exactly, from November 2014 to November 2016. And it sounds like you all ended up with 27 action steps. And then, great. And we did have a question about the coalition structure itself. And you touched on this a little bit, Cheryl, when you mentioned that the 24-member work group was really the working committee. And you referenced quite a few sectors were involved. And some folks on the line were just wondering if you could just name a couple of sectors, or maybe sectors you didn't anticipate would be at the table but ended up being an important part of the conversation.
Sure. Our goal was to make sure that all of the sectors of the food system were covered. We wanted our producers, our processors and distributors, our commercial buyers, and such as restaurants and institutions, as well as our consumers to be represented. And so if we look through our working committee members, and of course the local food action plan is available online, and the last slide that is currently up has the website, and everything that we've talked about is outlined there as well. But you'll see that we do have a working committee member list, and it included our school food service director, some financial organizations, our local farm bureau, our local conservatory, a number of community gardens, not-for-profit groups, our regional planning commission as well, our emergency food system, our solid waste authority, Ohio State University Extension. So Matt, does that kind of give a summary of the basic groups?
Yep.
And then there was a project team that consisted of city and county staff as well as leadership from our local nonprofit, Local Matters, that is a grassroots food justice organization. They were a strong partner in the planning process as well.
Great, fabulous. Thank you for that additional detail, and thank you for including the link on that slide. That's useful for folks to check out and take a deep dive into the plan itself. We do have a couple of questions about the use of GIS software. So did you end up making any maps or mapping the food system or mapping your assets as you went through this process?
That's a very good question. It's a topic that we debated at the beginning of the project, and we ultimately decided not to do any mapping with this project. There are a number of mapping efforts currently underway in Franklin County and Columbus, and we didn't want to duplicate any other work that was going on. And we felt as though the work that needed to be done with the Local Food Action Plan didn't necessarily need to be supported by spatial data.
And to add to that, what's progressed through this process is while there were a number of maps that were being created for specific purposes, that number has grown exponentially in the 2 years while we were planning, completing the plan. And so one of the tasks that we've taken on recently on our coordination communication side is to bring together the folks who are creating maps with the folks who are trying to use those maps in our decision-making process and begin to try and build a common language. So for example, the request of, have you mapped all the healthy food resources in a neighborhood? Well, yes, depending on how you define healthy food resources. So we're trying to get a common language, establish a baseline map that will be tracked across our community, and then a repository of basically who's mapping what, who's capturing what, so that as projects come up and need it, we can say, here's a place where you can go and know who's doing that type of work. But we're trying to get our hands around what's the common denominator that everybody's looking for.
Great, thank you. That's very helpful. We do have a couple of comments, not so much questions, but just reflections on your point about equity and really bringing cultural competency into that conversation. And folks responded very well to that and appreciate your thoughtfulness around that. And I just wondered if you could talk a little bit more about how that bubbled up, if that came through the neighborhood reports, or was that a lens that you incorporated from the beginning?
I think it was a lens that we gave intention to in the beginning, but it became much clearer, and the importance of calling it out specifically became very clear to us as we went through the process. I think we all tackled it with the perspective that was important, but the simple function of making sure that it was included in the written plan and called out as a specific action in the plan to engage groups was really important to our community residents, and it came out very strongly in the public feedback sessions. It was present in the neighborhood planning conversations, but I think the public feedback sessions really are where we got that strongest response, and we actually redrafted a number of things to strengthen that language as a result of the public feedback sessions. So, so I think I covered the points that you asked there.
Great, thank you. And then we just have a couple of quick final questions from folks. One is just about the role of the local council of governments, and I know you mentioned lots of folks are involved and at the table. Did you receive any support or feedback from the local COG?
Is that question referring to the Franklin County Local Food Council or our legislative sponsors in the form of our city council and our county commissioners?
I believe it's the latter, the county commissioner, but if you're still on the line, feel free to clarify.
So this project really was initiated because of a desire from County Commissioner John O'Grady to provide additional support into the local food system and having a strategic plan for that. And in addition, Councilwoman Priscilla Tyson was also very concerned with this issue of local food access for residents. And so we most definitely had the support of the county commissioners and City of Columbus City Council, and we would not have been able to initiate this project without their authorization to work together.
and their authorization, and then again also their appointing the advisory board. Those will be invited seats with from our council members. Both of those things really give a level of support to this that I think are going to be essential to this being an implementable plan. So they drove the process. We reported to them consistently throughout the program. They attended our working committee meetings on a number of occasions. So I would say they were really essential to this plan coming together and to the work that's happened so far.
Great, okay. And it does sound like Vince was thinking about maybe scaling up to the regional level and sharing your work or connecting with folks outside of the county as well. Is that on the horizon, would you say?
Yeah, that was something that was made very clear through this process, that we here in Franklin County and Columbus are definitely going to need to rely on and work with the surrounding counties and communities in this food system work. And so we have had discussions as far as how we work with the regional, in a regional perspective, and that's something we'll continue to work on.
Great. Well, thank you both so much for staying after the webinar to answer these questions, and thanks for the folks in the room for continuing this conversation. It's been a really fabulous presentation and discussion. So we have recorded today's webinar, and it will be available on APA's YouTube channel as well as on the Plan for Health website. You'll receive a copy of the presentation and recording via the GoToWebinar email in just a couple of days. But if you have any questions, feel free to reach out to me, Elizabeth Hartig, ehartig@planning.org, or of course Cheryl and Matt have left their email addresses on the screen as well. So thank you again, Cheryl, Matt, and Kayleen for being on the line. We really appreciate your time and all the great work you're doing in Columbus.
Thank you,
Elizabeth.
Thank you.